Very good morning. We will start today the rheumatoid arthritis. Sharing here the screen. Is it visible? Now see here the rheumatoid arthritis. Rheumatoid arthritis. Tis means what? Any type of tis. It is a suffix. Means what? Inflammation. Arthritis. It is the inflammation of the joints. Inflammation of joints. Rheumatoid arthritis. Okay. Now see here. This is a disease of bones, comes under the bones and joints disease. Okay, one of this one, that is the rheumatoid arthritis. It is a chronic inflammatory disorder affecting many joints, including those in the hands and feet primarily. Mainly it affects to the joints of hands and feet. You can see the rheumatoid patients, rheumatoid arthritis patient, the bones of the hands and feet are deformed, isn't it? The shape becomes little bit changes. That is the deformed. Okay, this is the chronic inflammatory disorder affecting mainly to the joints. It is an autoimmune disease, also called as an autoimmune disease. Autoimmune disease means our own immunity system attacks to the cells, healthy cells of our body by mistake, causing the inflammation in the affected parts of the body. Affected parts of the body means mainly, primarily the joints, usually at a one time. Usually it attacks to many of the joints at once, one time only. Okay. Autoimmune disease, understand this one. Autoimmune means what? Our immune system only attacks to the healthy cells by mistake. This is by mistake, and that causes the inflammation. Inflammation, painful swelling, too much painful swelling. So this is the autoimmune disease. You can also write here, it is a chronic autoimmune inflammatory disorder. Inflammatory disorder in one sentence. Okay. So understood this one, inflammatory disease and autoimmune disease. Okay. In severe cases, it attacks the internal organs also, not only the joints, but it also attacks to the internal organs, that is the eyes, lungs, heart, blood vessels. Okay, in severe cases. But in severe cases, it occurs in the age group of 30 to 50 years of the age. At which year? At which age? 30 to 50 years of the age. Okay, it is primarily affects the synovial membrane and then followed by extra articular tissues. Actually, primarily, initially, it affects to the synovial membrane and then it is followed by the extra articular tissues. But in severe cases, it attacks to the internal organs also. Internal organs also. Now see. Over the long periods of the time, the inflammation associated with rheumatoid arthritis can cause bone erosion and joint deformity. Before also I told you, it causes the deformity in the joints. Okay, changes the shape, size because of the bone erosion, because of the erosion of the bones. If it is long periods of the time, it affects, if we will not take care, then that inflammation associated with this can cause the erosion of the bone and joint deformities. While actually there is no cure for the rheumatoid arthritis. Are you getting? There is no any cure for the rheumatoid arthritis, but physiotherapy and medication can help to slow the disease progression. Slow the disease progression with the help of physiotherapy. That is the exercise, physiotherapy. You know this one, isn't it? Nowadays, this is the main physiotherapy. Directly no medication but exercise. Physiotherapists are there. Okay. Physiotherapy and with medication can help that progression of the disease will be slow. Most cases can be managed with a class of medications called as anti-rheumatic drugs. Okay, anti-rheumatic drugs, anti-rheumatic drugs. This is all about the introduction of the rheumatism, okay, or rheumatic arthritis. Okay, so it is a chronic inflammatory disorder. It is a chronic rheumatic arthritis. You can also call it as autoimmune disease because our own system only attacks to the healthy cells and that causes the inflammation. It occurs mainly at the age of 30 to 50 years of the age. In severe cases, it attacks to the internal organs also. That is eyes, lungs, heart, blood vessels. Okay. But primarily it affects to the synovial membrane and then followed by the extra articular tissues. Okay, actually there is no any cure for the rheumatoid arthritis, but we can slow the disease progression with the help of physiotherapy and proper medications. Okay, now see the etiology. Actually, it is a genetic factor, smoking and vitamin D deficiency. See carefully. Genetic factors. Half of the risk of the rheumatoid arthritis is believed to be genetic, hereditary, okay, from parents to the offspring. It is strongly associated with the inherited tissues, hence the family history is important. Okay, and next one, that is the smoking. Smoking, who smokes more? Means that's why the risk is mainly to the heavy smokers and that also to the men's, okay, than the women. So smoking, it is a more common in the smokers and then non-smokers, okay, particularly in men, heavy smokers, and then who are rheumatoid arthritis, this rheumatoid factors positive. Next one, etiology, that is the vitamin D deficiency. Understood this one, etiology? Mainly genetic factors, smokings, and vitamin D deficiency. Now see the symptoms. What are the main symptoms? That is the pain, swelling, if there is any swelling, if there is any inflammation. So there is a pain. Where it is? Joint. That's why joint pain in the feet, hands, and knees. Where the joints are there the pain is there. Because the rheumatoid arthritis affects to the joints, that also many joints at one time. That's why it is called as a joint pain, inflammatory joint pain disease. So joint pain in the mostly in the feet, hands, and knees. Joint stiffness is there, hardness, not the moving is improper. When we will move, that time there is a pain because there is a stiffness. Joint swelling is there because inflammation is there, that's why swelling is there. Joint redness is there because of that inflammation. Okay, joint pain. Joint warmth, because of that little warmthness is there, hot little bit. Okay. Deformity, the shape changes, see, that is the means they bend, isn't it? That is we got because of the erosion, bone erosions. Okay. There is a deformity. Joint tenderness is there, hardness, tenderness is there. Fever, low grade fever is there. Loss of appetite, loss of weight, because of these swelling, these inflammation, pain, there is a loss of appetite, so ultimately weight loss is there. Fatigue, lethargy, anemia, rheumatoid nodules, muscle aches, muscle pain will also there ache, that is the pain, muscle ache, that is the pain, muscle pain. So these are about the signs and symptoms. Okay. Now see here the grades of the rheumatoid arthritis. Rheumatoid arthritis grades: mild grade, moderate, severe, and end stage. Now see the symptoms according to that criteria. Mild, in this mild rheumatoid arthritis, pain only upon the exertion and carry all activities. Means what? Pain during only exertion. When there is exertion, that time only the pain. Otherwise, if the patient is relaxed, no any pain. Okay, they can carry all activities. All activities they can carry. Moderate restriction to the activities with increased pain. Some of the activities restrict because of pain. Because of pain, they will not do all activities because of there is a pain. They restrict the activities in the moderate grade. Now severe, you see marked restrictions. Activities are limited to self-care and pain even at the rest, even though the patient individual is taking the rest, that time also there is a pain. In severe case, marked restrictions, no activities, it will not allow any type of activities, even though the pain is there at the time of rest also. And the end stage, completely dependent, will not move, completely dependent. Okay, this is all about the grades: mild, moderate, severe, and end stage. Now see the diagnosis. Blood test. Actually, first you have to write that one, physical examination. Okay, that is the important. Now next one, that is the other main diagnosis, that is the blood test. ESR, erythrocyte sedimentation rate. Okay, if it is increased, then the doctor can diagnose that there is a inflammation is there. Okay, CBC, complete blood cell test. Okay, complete blood cell test, blood cell count. Okay, detection of antibodies called as rheumatoid factor. If it is present, then obviously it is there is a rheumatoid arthritis. Detection of antibodies called as, if found rheumatoid factor, then obviously there is the patient is suffering from rheumatoid arthritis. X-rays, in this case the radiation is passed through your body to examine your bones and joints. We can find this one. MRI. Okay. MRI uses the radio waves and strong magnetic field to produce the detailed images of the bones and the soft tissues, including the cartilages. Means along with that X-rays, if we will take the MRI, more images we can clear, all images we can take out, and so that we can confirm. And this is also the same, that is the ultrasound scans. In this test, high frequency sound waves are used to create the images of the joints. Here all images we can take and we can confirm that by seeing this one, patient is or the individual is suffering from rheumatoid arthritis. Joint fluid analysis. A needle is inserted into the affected joints to draw the synovial fluid. And in that fluid, if you will found any type of this one rheumatoid factors, then obviously we can say that the individual is suffering from rheumatoid arthritis. This is all about the diagnosis. Okay, blood test, X-ray, MRI, ultrasound scans, joint fluid analysis. These are the main what? These are the main diagnosis. Now treatment. Actually, there is no any treatment, but we can by with the help of physiotherapy and the medications we can slow the progressive disease, we can slow the disease. Okay, non-pharmacological therapy. Non-pharmacological therapy means only the physiotherapy. Lifestyle we have to change. Okay, with the proper diet, vitamin D deficiency is there, so take the vitamin D by taking the sun bath. Okay, so collect the information regarding the symptoms and change the lifestyle of the patient along with the lab diagnosis. So we have to change the lifestyle of our lifestyle. Okay. Non-pharmacological measures like rest to affected joints. We have to give the rest to that affected joints. Healthy diet, use of splints. Splints, support and controlled exercise, that is only come under the physiotherapy. Okay, controlled exercise. Okay, along with the means by under the supervision of this physiotherapist. Okay, now see the drug therapy. If there is inflammation, we have to take the NSAID, that is the non-steroidal anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, NSAIDs. If you not remembering, write down non-steroidal anti-inflammatory drugs, that is the NSAID, to control the swelling and inflammation. Example, aspirin and ibuprofen. OTC products are, these are the OTC products we can get over the counter. Okay. Now see the steroids. If more we can't control, the patient can't control the pain at that time, we have to give the steroids along with the NSAID. Corticosteroids for short-term treatment. Short-term treatment. Do not use long-term. These are the worst drugs. Okay, so one stroke, that is sufficient. In case of pain not controlled by the NSAIDs, if it is not controlled by NSAIDs, these above drugs, then we can give the one stroke of the steroids and the patient exhibiting serious extra-articular features. Okay, exhibiting and the patient exhibiting the serious extra-articular features. Deformities are there, erosions are there, inflammation is there. So that's why one stroke we have to give the steroids. Specific anti-rheumatic drugs, special, that is the gold compounds or penicillamine given as intramuscular injection or by oral route are useful for temporary remission of the diseases. Temporarily we can give an oral, or otherwise if it's hectic, then give the intramuscular injection. Okay. Immunosuppressants. Immunosuppressants, anti-immunitary, this is the autoimmune disease. So we have to give here the this immunity, we have to suppress that one. So that's why we have to give here immunosuppressant drugs. Example, cyclophosphamide, methotrexate. How much you can remember? 1 or 2 sufficient. Okay. Alone or in combination with the steroids can be used to control the immune-mediated inflammation. If there is immune-mediated inflammation, we have to control by giving the immunosuppressants. Lastly, surgery. Surgery, it is the last option and decision is based on the affected joints, where it affects, stage of the disease and age of the patient. See, all these are the criteria whether we have to go further, that is the end stage. Which type of the joints are affected, stage of the disease, which stage is there, and lastly, that is the patient's age is important. Okay. It includes the simple excision to total joint replacement. knee and hip joints totally we can replace. Okay, if not movable we can replace that one, hip and knee joints. Synovectomy, that is the removal of the synovial membrane. Vectomy, that is the cutting, that is the removal. Okay, which synovectomy, synovial membrane removal, is preferred at an early stage. If it is early stage, then only we can prefer, otherwise we will not prefer, because the age dependent. Already I said that one, it is depend on the which type, which joints are affecting, stage of the disease, and even the age of the patient. If early age 30, 40, below 50 or 40, then only we can go for this surgery. Now see here the complications. Osteoporosis, definitely there is a means porosis, fracture will be there due to that arthritis, inflammation, heart problem, lung disease, infections, other infection will also takes place. Okay, this is all about the rheumatoid arthritis. Okay, complications, maybe in every disease there is a complication is there. Okay, so this is all about the rheumatoid arthritis. Understood this one? We will stop here.